I sometimes say to patients is I'm really just doing a targeted fat pad replacement. I'm not trying to give you massive cheeks. It's about looking for little fat pads that need to be replaced. And there may be lots of injections in little places that all amount to a fresh overall look. So you're beautiful the way you are. And it's something that we all, I want people to feel that way about themselves. But the problem is, if they're stuck in a hole and I try and deny that they're stuck in a hole by saying, oh no, you're beautiful. And I've done that lots of times. So reassured someone and actually I don't really help them. They think, oh, he's a nice guy. He told me I didn't need it. But I still, every time I look at my Facebook pictures, I hate them. Has anyone reassured someone who and tried to make them not feel bad by saying they didn't need a treatment when you know that they did? I'm sure you all have, because I've done it lots of times. I did it to one of Miranda's friends. She came up, people do this in social situations, and I've known her for longer than I've been in aesthetics, and she comes up and says, I was just wondering about getting my eyes done. And for some reason, I instantly went to, oh, I don't want this person to feel bad. Like, I've known them for years. I'm just going to tell them that I like them. Like, I like your wrinkles. And I was like, afterwards, I just felt this horrible sense in my chest. Like, I didn't really help her at all. Like, she might think I'm a nice person, but she was actually asking for help. She's stuck in a hole. That thing is stopping her from doing things. And I've tried to make her, in fact, I don't even know if the honest truth is that you are trying to make them feel better, or if you're trying to make sure that you don't lose trust with them. So is it about me not making them think I'm criticizing them so that we can still be friends? Whereas actually, she was actually asking for help. So you're beautiful the way you are is something your mum should say to you, and something your husband should say to you. And it's something hopefully all your friends should say to you, but it's not something a cosmetic clinician should say unless they really, really believe it. Now, there are people who don't need treatment and they need to be told point blank, you're technically perfect, go and enjoy it. And I do that as well. But you're beautiful the way you are is not actually helpful. And it's something I think we all battle with. So acknowledge it. It feels uncomfortable, but part of what I'm going to give you today is the sequence of constructing your consultation so that it feels natural to say the things that aren't right. It's about Yoda again. So listen, I must, as he would say. Help you, I will. Push you in, I did not. So that's the key thing for me to realize, that just because they're in a hole and they feel awful and I identify exactly how deep that hole is, that doesn't make me responsible for putting them in the hole. In fact, I'm someone who can help them out of it. And that can free you. If you can suddenly realize this is what my job is to find out the depth of someone's hole and whether I can help them out of it so they can carry on their journey. It starts with getting to the real problem. So the story, and this is where I'm going to introduce Lindsay's story. And the interesting thing about Lindsay's story is that it evolved over time. I'll touch on that once I've shown you the video, but the first time I saw it, it was slightly more superficial. And then in the next bit of the conversation, it got deeper and it felt more serious. And then finally, the truth came out, which is what happens with stories. And it's not always because the patient doesn't want to reveal it. It's because almost sometimes they haven't articulated it fully. And it's almost like in their process of trying to explain themselves, they dig deeper and then they get to the real truth of what's driving them. But it all starts with the story.
Basically, I've changed so much over the last 10 years. And I just don't feel like I've got confidence anymore to do a lot of things in my life that I used to. I just feel like my facial expressions have totally changed. I always had quite sharp features, from what people have said, the high cheekbones, the good jawline, and it's all kind of sunk and disappeared, and I just feel really self-conscious now. I'm quite embarrassed now to get my photo taken. I don't like getting my photo taken with my children. I don't like putting my face on a camera. If people are messing around taking selfies or taking photos, I always dread the fact if I'm in the background, or we go out walking somewhere, or we take the dog out for a walk and my little one has his camera out. I don't want to be on the photos, but it's not great because it's the thought of growing up and my kids not having photos of me, or not having memories of family time because I'm refusing to get on the photos with them all. I haven't got very many with my own dad. My dad died when I was 5, and I maybe have 2 photos with him and not very many memories, so I just think that my kids need me on a photo. I want them to be able to look back and look at memories, and it's something I haven't got that I would have loved to have. Even talking to people I'm finding more and more difficult. Putting myself out there in my new business, I don't feel like I can do that. I don't feel like I can get in front of a camera. And it's a big part of the business, I think, trying to promote what I do and trying to get my point across, and try and be approachable. I just don't feel like I'm approachable at the moment. I don't think I've got the confidence to stand in front of a camera and, you know, show what I actually look like to people. I don't feel like I'm actually worthy of being on camera yet, because I just don't feel like I look like somebody who should be advertising aesthetics or the aesthetic business. I'm conscious when I talk that everything sucks in. So again, I feel uncomfortable in that kind of situation, talking to people I don't really know, which again isn't great in social situations or very good in my job. Simple things just like going shopping and trying clothes on. You know, I just look in the mirror and I can't see what I'm wearing. I just look at my face really, and I like taking other people shopping. I can't shop for myself anymore.
So what I love about that story is, I've said it to Lindsay a few times, is that she's so not alone. This is such a human thing, and I think a lot of people miss it. We all have to confront, there is this ultimate tragedy to life that you get older and you have to let go of lots of parts of yourself. But really what aesthetics allows you to do is to continue in your prime. The thing that's different about it is, I mean, sorry, I always get emotional when I talk about it. I don't know why. But it's what I love about what we can do is that I believe we have a good shot at giving her back her prime and reconnecting her to the real person that she feels on the inside, because this is really what this is about, is that there's an identity shift that's going on. And if you talk to many of your patients, you'll find many of them have this painful jolt between what they think they're going to see and what they do see. And it's fundamentally because your identity is actually set in your 20s and 30s. So the further you get away from your 20s and 30s, psychologically, it starts to feel like this is someone else. And that's painful for all of us. We're all on the same train on different carriages, but we're all going the same direction. But it's not exactly superficial and vain, is it? And that's probably my primary message, is that there's so many patients who are racked with guilt around, like, oh, am I vain? Am I superficial? But this is not Lindsay's story at all. The thing I wanted to talk about as well was the way that she initially told me when I first met her that she wanted to promote her business better, and then it became around. It was revealed that she wanted family pictures, and then the element of her dad came out, and then it suddenly all made sense. This is so much deeper than just promoting your business, although she's going to be able to do that well. She's already done that. She's already posted a picture of herself this morning. So she's on her journey, which is what I'm really happy to see. So where is she going? And how can we help her get her there? That's the story. The highest goal of the consultation, I believe, is to decide if the clinician can help the patient in their story. And everything else has to lead to achieving this. To do this, there are 3 vital domains. It's not just one or the other. So there's the psychology. This is where it all starts. I don't think you can, as a medical person, take a risk with someone's physical health unless there's an objective benefit to their psychology. Ultimately, it's a bit like saying, if you had a dog with a funny nose and would you inject it to straighten it if the dog doesn't care? Like, everyone could say that's unethical because dog doesn't care. It's a little bit, it's like that with people as well. We want to find treatments that are actually going to make them feel differently, because otherwise you're no different to a tattoo artist or something like that. There's no healthcare element to that. We also need, in order to do that, you need to understand the aesthetics. So I'm actually the complete opposite to the plastic surgeons in my industry, because I think it's psychology first, aesthetics second, and anatomy third. But you need all of them. But that's the sequence you go through. We need to understand the patient. Then we need to understand the aesthetic diagnosis, which Lindsay also gave in her consultation. some of it. And then we need to understand what's going on with the anatomy underneath. And those three things is how you build a perfect treatment plan. Okay, so the aesthetic diagnosis. How do we make and explain the aesthetic diagnosis? Before you start doing a facial analysis, you need to give someone an idea about what beauty is. I mean, and I also learned this the hard way, because if you learn that temple volume loss is not great for beauty and you just tell someone you need your temples doing, which every time I train a new doctor for our clinic, that happens somewhere along the line, is I get the feedback that he's a really nice guy, but he's a salesman. And I was like, why? I know he's not. Like, I know he's actually as scared as I am of doing that. And it's because the consultation went down the route of, you need your cheeks and your temples doing, but there's no explanation. You need to understand, you need to be able to explain to people in ways they understand what beauty really is. And I don't think a lot of people get it. So I use ELSA. So one of my false beliefs at the beginning as well was I should only treat what the patient has specifically seen. So you choose the area that you can see and I'll soften it for you. And what I've realized is the bulk of what is making Lindsay look different is actually unconscious to her too. Like, there are the key things that are pain points, which she touched on, but there's a lot more going on that is almost a subconscious perception. It's more the feeling that we get. So we need to change that. So part of that also relates to the story, which is the individual wrinkles are not or lines or shadows are not enough to explain what she feels about her face. So it's linked to the saying what I really like, which is all the world is stage, and all the men and women are merely players. They have their exits and their entrances, and one woman in her time plays many parts. And really what's going on in terms of her consciousness is there are all these players in her mind. It's not just as we picture her today. And this is also similar to the waiting room analogy, is that none of us, that there's so much more going on behind what you see that is built into how she perceives her face. It's the whole story and where she's at now and the role she's trying to play that are related. So the request is not always related to the story. In fact, the lines and wrinkles on the surface are no more than props on the stage in terms of understanding what's actually going on. We need to dig deeper. So if the story is made of many pictures, we need to think about our aesthetic diagnosis in terms of all the different components of how she sees herself and how others see her, rather than just the initial introduction, which is often something like this. So patients pick out an individual component and they say, I want that line gone, and I want that line gone, and I want that shadow gone. And my belief is that the underneath that is something a lot deeper. There's a lot more that she perceives that she's unconscious of, that she needs an expert guide to actually make her aware of, so that she gets what she really wants instead of just softening the one shadow that isn't really going to take her on the full journey. So we must see the bigger picture, and it is like the tip of the iceberg. Usually the things you see first are the tip of the iceberg, and there's this wonderful, challenging and exciting journey of trying to make yourself conscious of all the elements of what makes up a human face and how you feel looking differently. Because another way of saying this is, I always think the best treatments actually make you feel different when you look at the patient afterwards. So you can get rid of a line or wrinkle and you don't get any difference in the brain chemicals when you look at them. And sometimes you do something that really changes someone's face and you look at them and it's like they actually feel more attractive to you. There's that sense of your chemical, you get that sense of beauty basically. So in many ways you could think of this as our patient. Now, it's not that we're trying to make her look younger, but it does help you to know that there's some element of her that is picturing this, maybe slightly older, because probably around 18 here, I would have thought. But there's an identity that we're trying to get back to that is based on something like this. So we need to ask ourselves, what has really changed? And Lindsay has her pain points, but there's a lot more to it. And this is where your facial analysis comes in. So that we need to articulate, and here are just 7 ways of articulating beauty that I can go through with you, but there are more ways of cutting it. But the first thing is around the light. Now, it's taken me a while. This I also got from Elsa. So if you think about what these artists who create cartoons are doing, is they have learned how to use light and shade to maximize what our brains feel when they look at it. They don't have to care about reality. They can amplify the things that stimulate our brains to feel a sense of beauty and connection. So what's happening on Elsa's face? Obviously, she doesn't look human, but The eyes are by far the most important thing. They're absolutely dominant. Everything on her face is there actually to frame the eyes in a way. Look at how the jawline follows the curvature of her eyes, and the eyebrows frame her eyes. Even the hairline, the nose is small and almost insignificant, and even the lips, interestingly, are not big, but they perfectly fit into the curves and the shapes. If you look at the light, even on Lindsay's face, Lindsay basically was a Disney princess when she was at that age, so beautiful. And look at the light how it crosses her face. Essentially, I don't know if I can get back to this one. It's almost like the geometry of the face is designed to hold up the eyes and present them to you. There's this sense that everything is there to present the eyes to the world. Even the curvature of the cheek, as I said, and it almost flows from the chin when the geometry is correct, and it is like a presentation box almost for eyes. I think when the geometry of the young face, you can see how that's changed as she got older. Natural aging. I don't think she's aging any worse than anyone else, but it is shifting attention away from her eyes. The jowl is competing proportion-wise. We have a few other. I think in the next slide it shows you a few other little areas of disruption that are subtracting some of those of the lines and curves, and basically making the eyes look slightly smaller proportionately. So lateral lid cheek junctions, another place you can see. All of this is drawing attention away from the eyes. She's still got beautiful eyes. It makes it a lot easier for me, someone with big eyes. So she's got a really important asset to her, but it's around how do we make them more of a primary feature would be one way to design a treatment plan. How do we make the eyes most significant? And we need to declutter. I use this analogy of the mantelpiece. If you've ever had a mantelpiece that starts to overflow with pictures from your kids or wherever it is, and you put too many things on it, it feels great when you clear that away and you just have one bunch of flowers on it. That's a little bit what we need to do with face, is declutter. So the next thing is emotion. So I choose a baby with the emotion because obviously they're as young as you get. But one of the other things that I believe challenges patients quite a lot is that it's not just about getting older, and it's not about the shadow. It's the fact that the emotions of your face start to not match how you feel, because for tragic reasons, all aging makes you look, virtually all of it makes you look sadder or tireder. So you get this slight downturn in her eyes, which you can see, very slight, but it's enough to give a sense of sadness, whereas before she was glowing. And that's a tiny shadow, and might be able to do something with that. We have the jowl, which looks a little bit also like a frown. The rotation of the chin upwards, which creates a chin crease, which makes you look sad as well. She hasn't particularly got it, but some people's lower lip starts to come out as well. You have the nasolabial fold, which looks a little bit like a snarl. And subconsciously, no one ever describes you as having a snarl, but it's one of the many very subconscious signs of that creates I just think of it as a more negative aura. So what we want to do is also, part of her pain point is this jarring emotional affect, and we need to do something with that as well in the treatment plan. Another thing to think about would be the complexity of the face. So what I've done in the second diagram is I've tried to look really closely on the computer and look for any change of angle or ripple in the skin and just highlight it so that you can see it. And you can see that in the younger face, it has this simplicity about it, and it has geometry and it has changes and curves and things. But as you get older, basically it breaks out into complexity. It's a battle between order and chaos, and ultimately that's also another thing life is about, is order and chaos. And we're trying to maintain some order and simplify her face to make her eyes more dominant. So this complexity, if you really get into, and I recommend you do this at least once or twice in your development, is get a client, get money out the window, as in prepared to pay for it yourself, and just go and create the best result you can, because you get to chase these details and see a really, really profound difference. Because normally we're constricted by, they booked in for cheeks or something, and they booked in for, and you think you can only do that. So you get a bit limited. So this complexity is a really interesting way of looking at it. Many patients talk about health. I want to look more healthy. Ultimately, beauty is all about health. But in Lindsay's case, the word, because unfortunately she works in aesthetics, she's heard the word skeletal, and someone said it to her, unfortunately. I think in an unexpected way, but a lot of patients understand the word skeletal, and we all look skeletal eventually. You start to see the underlying structures. And this is about, it's about health. So we're trying to blend in these structures, because you only normally get to see the skeleton if someone's lost a lot of weight or they're older. And that's why it's associated with health. And in Lindsay's case, it's particularly this little shadow here that we need to do something about in order to harmonize and give that healthy fullness back. That's just to show you underneath where it all lies. So symmetry is another form. I actually think symmetry is slightly overrated. It's you can be very beautiful and have asymmetry, but it's definitely on the list that you might want to look at a face and pick out the areas that are slightly asymmetrical and see what you can do to correct them. But most people have some symmetry, some asymmetry. In fact, if you're too symmetrical, it can make you look almost CGI. There is a theory that it's almost so rare to see completely symmetrical people that it can make you feel slightly weird about them. There was a 7 Series BMW that was in the 80s that apparently looked too sinister, and instead of trying to redesign the whole thing, they discovered by just creating an asymmetry in one of the wings, it kind of lowered the tone slightly, and it was less scary. So it was an interesting design thing that they used to soften faces. Soften the face of a car. You've also then got the golden ratio. It doesn't really show up so well on her because of the 3 dimensions, but I'll try and show you the next picture. But she has a little bit of room in her chin to bring that down slightly. But her proportions are fundamentally good, but it's another way of interpreting a face and explaining to patients how they could be more beautiful with a different treatment. So this is a tool that artists use to draw faces. And you can actually see in her case the geometry which we'd like to try and catch, and you can see where it doesn't fit that geometry, particularly the chin and the jowl are the 2 areas we'd like to change the most. Okay, so once you've understood the aesthetic, we then need to try and understand what's going on underneath the skin, because if you only understand the aesthetic and not the anatomical, your treatment plan is not necessarily going to reflect that really well. So what's the underlying process that is causing these aesthetic changes? And this is also important for your patient to understand, because they need to understand, for example, why you're injecting their temple when they have buccal fat loss, for example. If they understand the anatomy, they'll understand it better. So it starts with the deep fat pads. I actually think at Lindsay's age, and for most of our patients, if it's an anti-aging treatment, it's virtually all about fat pad replacement, because we have this disunion that occurs between different fat pads. And we've got to try and replace them in the right order. So in Lindsay's case, this buccal fat pad is key. We have the deep medial cheek fat, which is slightly a little ripple here. The SOOF, which is associated with the tear trough, that's a suborbicularis oculi fat pad. And those are all the deep ones. On top of them, we have the superficial fat pads. And these are also really key, because most of Lindsay's aging is actually, in terms of the upper third of her face, is about the superficial fat pads. So temples, forehead's actually doing really well. There's a little tiny ripple here you can see, which might be associated with the loss of volume in the lateral fat pad. And then it's these fat pads over here in relation to the mental fat pad, premental fat pads that need to change. So we're really, what I sometimes say to patients is, I'm really just doing a targeted fat pad replacement. I'm not trying to give you massive cheeks. It's about looking for little fat pads that need to be replaced. And there may be lots of injections in little places that all amount to a fresh overall look. The key for me here is that this fat pad probably isn't bigger than it used to be. It's probably just out of place because of what's happening above it. And we'll come back to that. So I think that the buccal fat pad is playing a key role. The buccal fat pad is normally around 15 to 20 mils in size, and it shrinks as you get older. And it can shrink by half, so you might have lost a huge amount of volume. It runs underneath the temple bone, and then all the way into this buccal fat area here. So from the temple down, it's all one structure that shrinks. And I think you can see that quite clearly in Lindsay's case. There's also the interaction with muscles, which is as you lose fat, the muscles get out of balance. So they're no longer resisted by the fat, and you're able to move more, and even the resting tone of the muscle can go up in those areas. And that's to do with I don't know if you remember, I remember learning in medical school about Sterling's law of the heart. The more you stretch it, the weaker it gets to a point. And it's about the overlapping myofibrils in the muscle, that if they're stretched, you actually get a relax in tone. And if they come to a point where they're more overlapping, you get an increase in tone. And this is what happens in faces. And it's why one of the reasons your eyebrows drop. And sometimes you'll see patients get an eyebrow lift from treating their cheek is because you've stretched orbicularis oculi beyond its most tensionable point, and it just releases slightly. And the same can happen in the lower face. Hopefully we'll see an element of that, which is if you replace this fat here, you get a decrease in the tone in the chin and also in the depressor angularis oris. So I'll hope that somewhere along the line we get to see a difference with that as well, because that's one of the ways that the fat pad and the muscles interact together. But primarily, the main thing we're going to be thinking about actually is going to be the superficial fat pads for the upper third of the face and the buccal fat pad for the lower third. So we've talked to our patient then, probably not in this much detail normally, but you should understand their psychological diagnosis, the anatomical diagnosis and the aesthetic diagnosis. And we really should try and put it together so that you can see one cohesive picture where it's all working. So this is the story as I see it. We have a mum who's striving to be fully present for her children in a way that her dad could not for her. So it's really important. She is hampered by the emotions that are triggered by confronting a difference in her identity when she sees herself in the mirror. There's actually nothing, from our perspective, you'd meet Lindsay and not think anything of her. She's just another person. But for her, she's confronting her identity each time she sees a reflection, and it's not matching, and that's painful. So she's avoiding those situations, which is holding her back from getting pictures with her kids. She has suffered a loss of a heart-shaped face of youth, which is caused by the upturning and relative shrinking of the chin, jowl, and that was also associated with jowl formation. She also has an overall increase in complexity of her face, that skeletal look we touched on, and a more negative affect, which is all caused by volume loss of most fat pads, with significant buccal fat pad loss, but relatively significant preservation of the jowl fat, with associated hyperactivity of the mentalis and the DAO, with an overall lateral tissue descent. So that's how I'd explain it to another clinician. That's not how I'd explain it to a patient. But you're unable to take pictures because your face looks different to how you're expecting it, and it makes you feel negative, so you're avoiding those situations. It's caused because aesthetically you're correct. You have a squaring of the shape of your face, which is less feminine. You have the little hollows, which remind you of a skeleton, or because someone said it to you. And what that's caused by your buccal fat pad shrinking and the other fat pads also shrinking, which allows the tissue to descend because some of your fat pads shrink and some don't. So we've got this dominance of the lower face. So most patients at that point get this real sense of certainty that this all makes sense. Like their story is understood, the aesthetic difference, what they see is explained and justified. It's not just their opinion, like there's a real thing that's different. And then the anatomy underneath is like the final nail, that this is definitely the thing that they need to do. And ultimately, this is why this affects your average treatment value. I didn't actually set out primarily just to increase my average treatment value. I just learned that when you go through this process, the level of certainty in your patients rockets, and they're like, well, why would I not do this? Everything is in alignment. Every angle we look at it from, it's the right thing to do. So that's the point. So now the difficult bit, or the fun bit. What's the number one priority? What do you guys think, having heard this story, where would your instinct tell you to start? Or what do you think the biggest, in terms of your strategy, anyone have an idea what you'd like to do as your number one priority for her? Mid-face. Yeah, absolutely agree. Mid-face, particularly buccal. But how can we make things worse? It's always a good question to ask. One of the things I know a lot of people try and do for the mid-face is to do cheeks. Now, there's part of me that wants to do cheeks too, but also if I do cheeks and I don't do something to harmonize them, I could make her look more skeletal. So there's an aesthetic risk here that if I overdo her cheeks, that this will look worse, and her temples as well. Temple, if you treat even a 35-year-old and you do a big cheek treatment and they've got a little bit of temple volume loss, suddenly they look 39. So we need to be careful about harmonizing these structures. So this is basically driving me up the face. I'm thinking, I would like to get rid of that. How do I get rid of that? I'd probably maybe want to lift slightly and directly fill it. I don't want to fill it without doing some lifting, or I'm scared it will make it look heavy. So I'm going higher and higher up, and I'm starting to think that maybe the temples would be a good place to start, because if I treat the temples, that's going to give me a bit more room to treat the cheeks, and the cheeks are the coat hangers that hang the whole face off. So maybe I can do a bit more lifting, because for me, this is probably the hardest bit. There's quite a lot of lifting to do to get that to lift up. So I'm going to need as much lifting power as I can. A great way to lift the cheeks is to be slightly above the zygoma. but I'm not going to do that without doing some of the temple. So we have to be holistic. When you're aiming for a natural, beautiful result, it ends up spreading. You can't, because faces don't age just in one place, they age holistically. So we've got to add some volume here before we start doing anything with the cheeks, and we've got to do some cheeks before we do too much over here. And we need to do all of that so we can lift the jowl, and we're going to need to do something in the chin as well to bring the jowl into alignment. So as you can see, once you look at the face holistically, you've got to start to think about everything. You can't actually do a good restoration just doing one component at a time. You can sometimes stagger treatments and do them in stages, and maybe hold yourself back slightly with cheeks so you do the temples later. It's okay to do that, but to get a really good result, it is very holistic. So this is kind of what I'm thinking we will do, which is temple volume replacement and lateral lid cheek junction. I want to get a little bit more of less of a shadow that's downward on this part. Tear trough, just a little bit. She hasn't got much of a tear trough, but it's important aesthetically that we get this light uninterrupted, because this catch light here and catch light here interrupted by a shadow is a big aesthetic problem, even if it's a small tear trough. I'm going to try and elevate her cheeks without making them wider by staying on the superior and inferior surface of the zygoma more often. So that's, instead of, we all do those standard injections directly onto the zygoma, I'm going to suggest we shift them slightly higher up and get more of a lift. I know Miranda talks about her treatment. I did that with her. She's like, I feel lifted. So that's what we want, is lift. Lift comes slightly better if you're slightly on the superior surface. Looking at the skeleton, there's a gentle curve to it. I'm talking another maybe 10% extra lift we might be able to get. We need to project her cheek slightly forward. You can slightly blocked it with the mark, but you can see that the shape of her cheek is slightly, and it's inferiorly projected here instead of up here. So one of the things in 3 dimensions I want to achieve is to project her zygoma slightly forward. The buccal fat pad is all this structure here. That's going to be key to this treatment working. You'll see that there's nothing going on here. I'm terrified of injecting here. We don't want anything over here, or it will make it worse. And I'm going to try and do some lifting of this fat pad from behind by pulling back as much as possible. So there may not be as much, I think, from the curvature of her face. There's not loads of room, but there should be enough that we can pull back, and this will also help the shadow underneath here. The chin is going to be key, because if you remember that picture of Lindsay at the beginning, she's got a beautiful chin, really, really sharp, actually. And actually, as she's got older, that's squared off, as is natural. So I think one of the key parts of this working really well is that we get to bring her chin inferiorly and focus it so that you get a better shape to it, and remove the distraction of that line as much as we can. We'll then need to blend that in with the jowl. So we'll do some mental fat pad replacement there as well. So coffee time, actually. Procedure afterwards.